everybody, and welcome to today's In Conversation with Manufacturing Chemist. Today, I am joined by Jamie Grabowski, who is the VP of Portfolio and Sourcing from the Pharmaceutical Discovery Manufacturing CDMO, Curia. Nice to meet you, Jamie. I think I'll first go into, could you tell us a little bit about your background and your role at Curia?
Of course. So, name is James Grabowski, VP of Portfolio and Sourcing. Been with Curia for around 16 years. Help our customers in terms of the development and commercialization of their API, active pharmaceutical ingredients. Been doing that for approximately the last 6 years with a great team here at Curia, and we have a great track record of getting people basically from that early stage thought, in the lab, all the way to GMP metric ton material of their API to help their patients around the world.
So you just said you've been there 16 years. Could you tell me some of your highlights and sort of the big milestones during your time there?
Sure. It's always great when you look back at your career and think about some of the things that you've done, right? And it's tough because when you go day to day, it's sometimes hard to see the forest through the trees and remember what you're working on. And you're so customer focused sometimes you forget to take a step back and say, okay, what are we doing collectively? I've been quite proud of a lot of the commercial launches that we've done with our customers, helping them help their patients. From prostate drug treatments all the way to help with COVID. Some of the biggest work that you've seen in COVID in the world that we've helped get through, lipid manufacturing, those kind of things. So it's been very, very exciting, especially in the last few years. It's been very different in terms of the speed that things are going to market. So it's been pretty exciting.
Yeah. Well, looking into your company and these sort of things, I kind of came across the "from curiosity to care" saying. Could you tell us a bit more about that?
Yeah, absolutely. So curiosity to cure to us is really helping our customers think through an idea. Some of the customers we work with are large pharma, right? Some are three people in a garage with a great idea, right? And so it's helping them think through, depending on where they're competitive, even with big pharma, right? Just helping them think through milestones, sometimes get through hurdles with the drug discovery pathway. But basically what we think of as curiosity to cure is going from that idea, again, that somebody has, all the way to actually being able to get commercial product out there to help patients. And we have the services and the platform to help customers get through any one of those individual stages. We also take a lot of pride in not just getting them what they're asking for, but also thinking and helping them think through sometimes what they need, right? Because sometimes customers are like us, right? They're so focused on the day-to-day that they can sometimes lose the bigger picture, and it might be the right time to talk about an alternative source in an intermediate. It might be the right time to talk about a CPP analysis on a certain step of a process in our development work to make sure that they have the most robust production and supply chain possible, so that when they ultimately get to that goal, right? Because it's hard to sometimes say, okay, we're getting commercialized and this is the goal. When you get to that goal, to actually get that drug to the patient, right, is incredibly important, and we can help them do that.
Well, so how specifically do you help life science customers sort of go from that discovery to that, eventual commercial scale manufacturing?
Yeah, perfect. It might be from hit to lead screening, right? In our discovery business unit, right? In our discovery services and our discovery sites. It might be helping you through some of the production of early tox batches in our development stages, right? It might be in looking at pilot plant scale and development scale or basically engineering batches in our commercial manufacturing suites to make sure that we're kind of fine-tuning the process before we go through the validation. Also, it's our regulatory teams, it's our quality teams helping them think through how they're going to file, when they're going to file, what they file, right? Some of these smaller customers that we have, or some of the smaller customers that we have sometimes not, there's three people. They might be like me, right? I don't have a regulatory and quality background. I'm a little bit dangerous in it. I know enough to be dangerous, but I'm not an expert by any means. And so we have those experts that can come in and help them think through their problems. And so that they don't feel like three people or four people or 100 people who are the only ones thinking on this. We can bring on our end almost an army together to help them get their drug to patients.
So specifically, what is unique about you? Why should a company choose to partner with you then?
I think it's the pride we take in the work that we do. I think it's in, if you look at a lot of different competitors around the world, you can almost go anywhere to get kgs, right? You can almost get anywhere to get material, right? It's the expertise in the steps that we take. It's the support that we provide customers. It's the strategic thinking that we support our customers with in each stage of the process that really adds value past just the service that we're giving, right? I think sometimes people focus too much on, okay, getting from point A to point B, and that's the ultimate only thing. You learn a lot when you're going from A to B, right? And it's how you handle A to B that helps you get from B to C. And that's really where we help our customers think through things and really get into the meat of what they're trying to do, so that by the time they get to the final stages, they are actually at the final stage and they have a very robust product that they can get to their patients.
Excellent. Well, that was really interesting. Thank you, Jamie. I think that's all we have time for. So thank you, Jamie, and thank you to everyone at home for watching. I hope you found this all very interesting, and thank you for watching and have a good day.
Okay, thank you, Sophie.